Can using a stationary bike help heal hip arthritis? The answer is no, unless you've done a certain thing, which I'm going to tell you about. But if you're using a stationary bike in hopes that it's going to help out your hip arthritis, and you haven't solved the root problem of your hip arthritis, then using a bicycle, whether it's a stationary bike or an outdoor bike, road bike, mountain bike, whatever it is, it's actually going to be harming your hip joint. And here's why. That root cause, that muscle imbalance, the way that this works, if this is the ball and socket joint of your hip, on the front of your hip, you have some muscles called the hip flexors. On the back of your hip, you have some muscles called the glutes, the butt muscles. Those two muscles have a balance that influences the position of the ball and socket joints. And if you're too dominant or too strong in the front because the glutes on the back got nothing, they're not very strong, then you're going to shift the ball forward in the socket and cause some bad pressure to go through your hip joints. Over time, as the weeks, months, years, decades pass, you're wearing your hip inappropriately, and this is what causes hip joint arthritis. Now, if you get on a bicycle and you don't feel that you're using your glute muscles consistently each time you ride a bicycle, then you're compensating. It's very, very likely that you're compensating with those hip flexors, maybe some other muscles that also pull in the front of the hip, like your TFL muscle, the tensor fasciae lata, and also some quad muscles in the front of your thigh. If you're using those muscles, if you feel like your thigh muscles get more tired than anything else on a bicycle, then you need to stop riding a bike right now because you're making your problem worse. Now, even healthcare professionals aren't aware of this muscle imbalance concept as a root problem of hip arthritis. In fact, they may tell you, go get on a bicycle. They may put you on the bicycle in the physical therapy clinic even. If you're feeling your quad muscles, the front of your thigh, working quite a bit when you're on the bicycle, even in the presence of another healthcare professional, this is potentially feeding into your pain. If you feel like you're getting worse going through this exercise, you need to say something, you need to stop, and you need to look at fixing the root problem of hip arthritis, which is going to be getting that imbalance addressed. It usually involves getting the glutes stronger. Now, there is a way to use a bicycle and use your glutes properly. And the way this works is every time you pedal downward on the downstroke of a bike, that leg that's pushing down, you need to tighten the glute of that leg each time you push down. And when you cycle around and you push the other leg down, then the other glute needs to tighten up. So riding a bicycle, whether it's an upright bike or a recumbent bike, one of the ones that has a backrest and you can lean backwards on, the pedals are in front of you, or if it's the one that's the pedals are under you, that's an upright bike, it doesn't matter. Every time you push your leg away from your body, the glute on that side should tighten up, and then you should alternate and the other side should tighten up. If you can do this consistently and make your glutes get the most tired out of all the muscles in your legs whenever you're on the bike, only then are you actually using the bike in a way that's beneficial to resolve the root problem that's putting too much pressure through your hip joints. Otherwise, it's hurting your hip. And it may not hurt in the moment when you ride the bike and you feel your thigh muscles working, but over time, you're gradually adding a bit more strength and a bit more strength. You're feeding into the imbalance by strengthening the wrong muscles each time you're cycling. And it's just a matter of time before you hit a certain threshold and your hip is worse. It doesn't feel good to ride the bike. Now, if you have a healthcare professional guiding you to use the bike, please do not get mad at them. Please do not, feel like they're out to get you or harm you. They're doing the best they can with what they know. And the general thinking in the healthcare field is that the bicycle is a very benign exercise. In other words, it's good for everybody, and there's nothing that can go wrong on the bicycle because it's low impact, and you're not having to put your feet on the ground and pound through your legs like you would when you're walking or running. But the fact is they're not trained specialists in helping people avoid surgery. Using a bicycle right after a surgery, like a hip replacement surgery, any kind of hip surgery, or a knee surgery of any sort, once you're able to get the motion to ride the bike, then it's generally a good thing because it helps you to get more motion and to get the muscles moving properly. But fixing an imbalance to offload excessive pressure going through a joint because that's causing hip arthritis, that's the root cause, then you need to make sure that you're using the right muscles on the bike. And your doctor or your physical therapist, whoever's helping you out, is probably just not a specialist in that. And they're doing the best they can with what they know. But you need to think about what's happening in your body, which muscles you're using, and make sure you begin to use the right muscles so that you're helping your hip arthritis rather than hurting it without really knowing that you're hurting it. Hey, if this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to see this. Share this with your healthcare provider. They may need to learn from this as well. And please comment below if you have any questions. We'd love to answer our questions from all our comments. And if you haven't subscribed to our channel yet, please do so and hit that notification bell so that you get notified every single time we post a video. Thanks for watching, and I'll see you in the next video. Bye-bye.